Clinically Integrated Network and Medical Director for Occupational Health at Henry Ford Health, Dr. Courtland Keteyian. Good afternoon.
Hey, Mark.
Good to see you.
You too.
You're in clinical scrubs today, or
yeah. I had to run from clinic today. I didn't have time to put the shirt and tie on, so.
It's probably cooler.
It actually is. I would have been drenched coming over here if I had a suit on today. So this is probably better. It's probably safer for me.
Well, thanks for braving the heat to be with us today. It really is recommended to not be outside for a long period of time. And it is, as we mentioned, Weather Service saying this heat does have a cumulative effect on the body.
So the like heat illness is a real thing, right? And on the kind of early spectrum is like, heat rash, right? People get like the skin stuff and then obviously sweating and other things like that. But on the far end, right, the serious side is heat exhaustion and heat stroke. And heat exhaustion and stroke can occur either exertionally, so this is like the high school football players, covered in pads, or it can occur non-exertionally, meaning that there's people who are maybe just more susceptible, so young children, infants usually under 12 months, or more elderly folks or people that have some type of health condition. And so, especially in conditions like this, where our body's not used to this type of heat intensity, and those kind of on the ends of the spectrums, people tend to decompensate or can decompensate more easily. And heat stroke is basically a body temperature over 40 degrees Celsius, which is 104 Fahrenheit, with symptoms. So the symptoms are usually neurological. They'll get confusion, kind of altered awareness of things going on around them. May also get headache and vomiting and things like that, right? Mm-hmm. So, the treatment is to cool them down as fast as you can, but it's a very, very serious condition. Actually, heat stroke can lead to death very quickly if not treated. Yeah,
because it does. I remember I think it happened to me once several years ago. I was super hot. I was on my bike, and all of a sudden it's like, oh my God, I couldn't go. I couldn't move another foot.
Yeah.
And I thought, this is it.
Yeah. Yeah. It's literally just it's a balance between our ability to cool the body, right, against how fast heat is, kind of being added into the system, right? So it's like heat in, heat out, and in this environment, our ability to cool is much more difficult. So if you have a lot of clothes on or a lot of layers, or like, the football player in pads, harder to cool your body. High humidity actually makes it very hard to cool the body, because our primary cooling method is evaporative, right? We sweat, it evaporates, that's how we stay cool. When humidity is up over 70 or 75%, we don't actually evaporate any sweat, right? Like it just all kind of sticks to you, right? Mm-hmm. And we're kind of in that environment. It's very high humidity, very high heat. And what happens is, and this is why it's worse in elderly or people that have other medical conditions, the heart really can't keep up, right? So as we sweat, we lose volume, right? Water leaves the system, we're sweating it out. And then our blood vessels dilate because it's trying to bring blood flow to the skin to diffuse the heat, and the heart, to keep up with cardiac output. The output of the heart is your stroke volume. How much do you push each time? Times the rate, right? So then the rate goes up because the volume goes down, and so the cardiac output is struggling to keep pace. And so it can put a lot of stress on people's hearts. And so if you're somebody that has heart problems, or you're elderly and you just don't have a lot of reserve, the kind of threshold to decompensate and get sick quickly is there. And that's why this is so dangerous for people.
So don't put yourself in that position in the first place.
Yeah.
Stay out of the hot weather, stay out of the sun, stay out of the limits. Drink plenty of fluids.
Yeah, it's definitely, if people can avoid being outside today, and can stay in a cool environment, especially for those who are susceptible, it's a good idea.
Today, we want to talk about vaccines because recently we've been seeing some things out of Washington that there's going to be changes in guidance to vaccines. First up, the COVID vaccine, and I think it's still up in the air. And as someone that is in the senior citizen category, I don't know what the recommendation is. I don't know what I should be doing, and I think I'm in the same boat as most other people.
Yeah, I think what's helpful is to explain. I think this process is pretty opaque, for most folks. What happens, and what did happen when we were kind of in the middle of COVID with all those vaccines, but what generally happens with vaccination is that anytime there's a new vaccine, there are extremely rigorous requirements to approve that vaccine through the FDA, right? So that's kind of step one. FDA is really evaluating the safety and effectiveness of the vaccine. So that's step one. Once it passes that bar, and that can take, generally speaking, that takes quite a bit of time, right? That can take years to do. Once that happens, the data is then evaluated by the ACIP, and this is the committee that was disbanded, basically, by the Secretary of HHS, by RFK Jr. So there were 17 members of the ACIP, and the ACIP then, these are people that are true vaccine experts, and most of them they don't come from industry, right? These come from academia, these are people who spend their life basically doing research on vaccinations, right? And so these are folks, anyway, from higher education. And so they ingest all this data and determine what the vaccine kind of schedule should look like. They then make those recommendations to the CDC, right? And then the CDC comes out with the guidelines that are designed, right, for all of us, for physicians to follow. We say, okay, well, this is what the CDC recommends based on the recommendation from ACIP, so then we follow those schedules. The importance of that is not only does it provide guidance for physicians, right, because we don't all have time to read the dozens of studies that are done, right? Nor even as physicians have the technical expertise to evaluate these complex studies. So we rely on these experts to help us do that. This is also what determines what insurance companies pay for, right? And what the CDC recommends, generally speaking, is what insurance will cover. There's actually statute that says what the ACIP recommends, those vaccines must be covered by Medicaid and CHIP, which is Children's Health Insurance. And so CHIP is kind of a Medicaid expansion in a lot of states for kids that don't qualify for Medicaid, but maybe in families that make slightly more money than the federal poverty level, which federal poverty level is actually, I think it's like $30,000 a year for a family of 4, right? So it's not a lot of money, right? 50% of kids in the country are on CHIP or Medicaid.
Half.
So if the ACIP and subsequently CDC change a recommendation around the pediatric vaccine schedule, it will change what insurance covers for 50% of the children in America. And we are right now in the midst of one of the worst measles outbreaks in my lifetime. There's been, in 2025, 1,200 cases of measles. That's 1,000 more cases than we had in all of 2024. That's directly related to vaccination coverage. And in 25, there's already been 3 measles deaths, right? So there's like a direct cause and effect between what will be covered, the impact that has on getting, because these families that are at the federal poverty level will not be able to afford vaccines for their kids. And if you're not vaccinated, then you get these diseases which kill people, right? So there is a link between what they recommend, what gets covered, and people's lives.
So, with the disbanding and elimination of the members of the ACIP, people will die.
I think you can reasonably draw, statistically speaking, that conclusion. And the people who were dismissed, the 17 folks who were dismissed, were, and I actually have the privilege to have met or know some of them. They, true experts that, I mean, there's no, they're vetted for years, right, to make sure there's no conflict of interest, right? These are very, very dedicated public servants. They get paid nothing to do this, right? So they're gone, and they've been replaced with 8 people that frankly lack the technical capacity to evaluate the type of research and data that you need to make decisions like the ACIP was making.
Or worse, they're already predisposed to be vaccine skeptics.
Yeah, I mean, the entire process for evaluating who these people are was, like usually this takes years. These 8 people, I mean, it can't be years, right? The administration's been in place for less than 6 months, right? So the process around how these folks were selected has not been transparent. And we know the backgrounds of most of them. And there are a few people that were appointed that are extremely, I mean, they have made a name for themselves essentially on social media, spreading vaccine misinformation. So some of these folks selected, I think, are extremely dangerous. So it kind of calls into question, you know, now what the CDC is going to ultimately recommend. We may not be able to trust those recommendations as physicians, and are going to have to look to other organizations on what those recommendations should be, like the American Academy of Pediatrics or other, you know, colleges that will have to help come out with vaccine recommendations. But it's difficult because we really, really rely, the physician community relies on that body and their expertise to help us understand what we should be doing for the public health. And vaccines, I think, have become politicized, but I mean, this is just sort of my perspective on things. Like, vaccination is probably the most significant technological accomplishment we have as like a human race in the last, I mean, you know, hundreds of years. The science required to do that and the number of lives that have been saved, I think it's very hard to argue. I mean, this is like putting a man on the moon level of complexity that we were able to accomplish, and to sort of ignore that is very, very difficult for a number of us. I think it's tragic.
The medical media is advising talk to your doctor, so it's really the onus is on your practitioner, and as you said, you don't have the time or the
yeah. I mean, I'm an epidemiologist by training, right? It's just to read and understand and analyze the volume of literature in the complexity of that literature and kind of make these decisions. You really rely on, I mean, this is no different than, right, like, you know, don't come to me for neurosurgery, right? Go see a brain surgeon, because they've spent their entire career understanding the evidence around, you know, when you should take out a certain type of tumor, or when you, right, like they understand these things, right? This is their entire field of study. And just like we have neurosurgeons, or just like we have orthopedic surgeons, or just like we have, you know, public health physicians, right? We spend our time learning these types of skills, and these are the world experts that have all been dismissed and replaced with, you know, social media personalities. So it is extremely concerning for those of us that give vaccinations as part of our routine practice.
So is there any kind of coordinated response from, you know, the healthcare community?
Yeah, I mean, I think people have been up in arms. The American Medical Association sent a statement last week asking specifically for more transparency around the evaluation and the vetting process that came up with these folks, and helping us understand what their technical expertise actually is. I know that a number of other associations, I mentioned American Academy of Pediatrics, family physicians, they've sent responses. So there's a number of organizations in the physician community. It's pretty clear that the administration isn't listening to any of us, but there's definitely been quite a bit of feedback coming from the physician community around the process and the selection process that was used here to identify these individuals.
All right. Well, I guess stay out of the heat.
Yeah, I mean, I guess what I would encourage people to do is, I mean, you should talk to your physician, right? And what I think this does is it actually pushes more onus back on to people to make decisions and kind of do that assessment of what is right for you. Mm-hmm. And so it's very important that people stay educated and informed from reliable sources. And unfortunately, that may not be the ACIP or the CDC, and the CDC is getting those recommendations from the ACIP. So everything has to be, I think, evaluated with that kind of in mind, and I think having the conversation with your doctor about what is the appropriate immunization for me or for my child or my aging parent or something. It is important to have those conversations with your physicians, and then it's up to the physicians to make sure that we're evaluating evidence from appropriately informed sources that has real experts that are making those recommendations.
It's your health, it's your children's health. It's worth the time and effort to follow that advice. As always, great to have you here. Thanks for coming in.
Thank you.
The president and CEO of Mosaic Clinically Integrated Network and the medical director of occupational health at Henry Ford Health. Next up.